So we are presenting the minimal residual disease data. That is one of the secondary endpoints of the study, and we are focusing on the maintenance part. So probably all of you know PERSEUS very well. So this is a phase 3 randomized study that compares VRD induction consolidation followed by len maintenance versus DVRD induction, transplant, consolidation, and DR maintenance. So in this study, the Daratumumab len maintenance part was for a minimum of 2 years, and then there was a response-adapted approach, and based on MRD data, patients that were MRD positive continue with DR until disease progression, and patients who were MRD negative sustained for at least 1 year, could stop Daratumumab and continue on len until disease progression. So what we are showing in the presentation is that for the DVRD followed by DR maintenance arm, there is a higher rates of MRD negativity, both at 10 to the minus 5 and at 10 to the minus 6. So it's interesting to see in the trial how responses go deepening throughout therapy, and that's the improvement in the responses occurs mostly during the maintenance part. And also from the MRD data, we see the same trends, so responses go deepening throughout treatment, more in the DVRD followed by DR treatment arm. Also sustained MRD negativity both at 12 months or 18 months, so it's also higher in the DVRD plus DR arm as compared to the VRD arm. And for example, at 10 to the minus 6, sustained MRD negativity at 18 months in the DVRD arm is 14%, which is a very good data. So MRD rates and sustained MRD negativity in the subgroup analysis favors DVRD plus DR treatment across all pre-specified subgroups, including older age, ISS3, or high-risk cytogenetic abnormalities. And if we take a look in the patients with high-risk cytogenetic abnormalities, in the trial these were defined as patients with deletion 17p, translocation 414 or 1416, the rate of MRD negativity, particularly we focus in the 10 to the minus 6 threshold, is higher for DVRD followed by DR as compared to VRD. Also, the sustained MRD negativity is higher for the DVRD arm, and this translated into longer progression-free survival for high-risk patients treated with DVRD. So yeah, overall, the data supports DVRD induction consolidation followed by transplant and DR maintenance as the new standard of care for the treatment of newly diagnosed multiple myeloma patients.